How often are cancer biopsy results false negatives? Have you ever wondered how reliable cancer biopsy results really are? It is a question that many families and caregivers have when facing a cancer diagnosis. Understanding the possibility of false negative results can be essential in navigating this journey. Cancer biopsy results can sometimes be false negatives. This means the biopsy test may not detect cancer even when it is present. The frequency of these false negatives varies based on the type of biopsy, the technique used, and the specific cancer being tested. For needle biopsies, which are commonly used to diagnose cancers like breast cancer, false negative rates generally range from about 1% to 6%. For instance, studies show that breast core needle biopsies have a false negative rate around 2.2%, with some reports going as high as 6%. This indicates that, out of 100 biopsies performed on malignant lesions, 1 to 6 may incorrectly show no cancer. Several factors contribute to false negatives. One major reason is sampling errors. Sometimes, the biopsy needle may miss the cancerous tissue, particularly if the tumor has both benign and malignant areas. The size and type of the biopsy needle also play a role. Larger gauge needles tend to have higher false negative rates compared to thicker ones. For example, in vacuum-assisted breast biopsies, 14-gauge needles had a false negative rate of around 4.4%, while 11-gauge needles had a lower rate of about 0.45%. Radiologic factors can also impact results. Occasionally, calcifications seen on imaging may not correspond to malignant tissue. This can lead to sampling benign areas and missing the cancer altogether, resulting in false negative results even when imaging shows suspicious findings. For families and caregivers, it is important to understand that a negative biopsy does not always rule out cancer. If there are still clinical signs or imaging that seem suspicious, doctors may suggest repeating the biopsy, performing a surgical biopsy, or conducting additional imaging to clarify the diagnosis. This proactive approach can help avoid delays in diagnosis and treatment, which is vital for achieving the best outcomes. While cancer biopsies are generally reliable, false negatives can occur in a small percentage of cases. Being aware of this possibility allows families and caregivers to advocate for thorough follow-up and maintain clear communication with the medical team when biopsy results do not align with other clinical findings.